We have come here, courtesy of Partners in Health and NMCM. We have a partnership. Partners in Health assisted us to develop the standards. We didn't have these standards before. Actually, it's a groundbreaking activity, and it's a huge milestone for the Nurses and Midwives Council of Malawi to have developed successfully these standards and the documents that have made us come here, so that we disseminate. We take these documents to the users.
These standards, which we supported the Nurses and Midwives Council of Malawi to develop and basically print and disseminate, are very crucial. Because one, when you talk about quality, I'll repeat, quality of nursing care, you can't talk about just quality without basically describing what type of quality you're talking about. So what these documents have done is basically to tell us and set that standard. To say, when we want you to be a quality or a critical care nurse, this is the standard that we want you to practice on, and we'll measure you based on this.
So after developing these standards and the competencies and the code of ethics, we decided that it's very important that, apart from just developing and then making them available, we should take an initiative to explain to the users of these documents, so that they understand what is contained in these standards.
So basically, working without the standards or the guidelines is like everyone can conduct the business of nursing and midwifery the way they feel, the way they think, using their personal beliefs, personal values, not following the universally accepted standards. So this is going to help us, first of all, as Neno itself. A nurse who is at the district hospital is going to conduct themselves the same way as the nurse who is at Nsambe Health Center, the same way as the nurse who is at Lisungi Community Hospital, because we are guided by one document.
My fellow nurses and midwives, let's take these guidelines as our daily tools that will help us to discharge our work. Yeah, go through them and know them inside out.
So what I would ask my fellow nurses is, let us follow these tools. And by following those tools, it actually helps you as a nurse to explain some of the actions that you're doing, you know. And as a human being, it's also a form of making sure that you can reflect to say, the care that I provided to this particular individual, no matter the outcome, I did that to the best of my knowledge, as well as according to the standards that are supposed to be provided.